So good afternoon. It's Good Friday and I'm here with the next NOSH update. Again, my name is Sarah Newberry and I'm one of the family physicians here and chief of staff of the two NOSH hospitals. I wanted to start by giving you a little bit of an update and letting you know that at this point we don't have any known COVID positive patients in our communities. We have, of course, been actively swabbing patients with symptoms and with risks, and we have continued to function under the assumption that we have patients with COVID in the community, but we have not had any confirmed positive swabs. And I wanted to say that I think in large part that's a testament to all of you, all those of you who came back from spring break and have self-isolated, those of you who came back from wintering in the southern states and have chosen to self-isolate, all those of you who've developed symptoms and have self-isolated, and those of you who've been really so diligent about practicing social distancing. So thank you to all of you for that. We do have new guidance from the province as of yesterday that assures us that we can test based on symptoms and not focus on the travel history or known COVID positive contact. So we will be ramping up our swabbing and assessments within the community so that we can do better at capturing a broader segment of the population and make sure that we're not missing anyone in our testing. So you'll see that ramping up this week as well. I wanted to make a comment about personal protective equipment. This is something that many of you will be hearing a lot about in the news. And certainly here at our two NOSH sites, we do have adequate personal protective equipment for now. But we do have concerns that when we begin to admit patients who are COVID positive, we may quickly run out. So as of this week, we are implementing strategies to conserve our personal protective equipment because we know that our healthcare workers are truly a precious resource in our communities, and we want to keep our healthcare workers as healthy as they can be so that they can continue to serve our communities and all of our healthcare needs here. As part of our personal protective equipment conservation plan, we have reached out to the community, and many of you have donated cloth masks, cloth surgical gowns, reusable head coverings that we can use here in the hospital. And I want to say thank you to all of you for your contributions to that. That is much appreciated. If you are at home making cloth masks and wondering if you can donate them, please be in touch with Charlene Schintz here at the hospital, and she can gather in your donations and ensure that those are distributed. So thank you again for that. As I started at the beginning by saying that much of our current situation of having patients who are not COVID positive here in the community is due to your work and your efforts. In a parallel way, what we will have to do in the hospital will also depend to some extent on what you do now. We have spent the last several weeks preparing our hospital, and we are ready for COVID positive patients. But as always, what we want to do is ensure that as much as we are able to, we focus on what you want and what your goals of care are. We know that people with COVID-19 can get sick seriously and very quickly. Many patients require intensive care and intubation in order to maintain their oxygenation and their breathing. But we know that there are many people who wouldn't choose that for themselves. They wouldn't choose to have to be far away from family and friends. They wouldn't choose intensive care or intubation. And so we want to invite all of you in our area to think about what you would want if you became seriously ill with COVID-19. This coming Thursday is Advanced Care Planning Day, and it's a really important opportunity to have conversations with the people who you love, your family and friends, to ensure that they know what you would want if the time comes that you're not able to speak for yourself. And if you need to come to hospital and we need to make decisions quickly about your care, if you have done an advanced care plan, that helps us to be able to be sure that we are doing what you would want us to do for you. In this COVID-19 era, there are some things that are very different about the way that we've done advanced care planning in the past, and many of you will have been in our hospitals with illness, and you will have had those conversations with us about what you would want if you became very sick while in hospital. And you'll know from those conversations that typically those conversations happen with your family around your bedside, so that the people who love you are part of the conversation. But in this COVID-19 era, when we can't have family and visitors in the hospital, those conversations will feel very different. And the more that you're able to have that conversation with your family in advance and come into the hospital with your wishes known in advance, the easier it will be for us to have conversations with your family on the phone and to continue to be sure that we follow your wishes in as much as we are able to do that. So that's one important difference to past advanced care planning conversations. The other important difference is that there may come a time when the resources of this system aren't able to provide what you would have chosen for yourself. And we're certainly working very hard across the healthcare system to try to ensure that we don't reach that point. But that will be a conversation that we will have with you and your loved ones if that need arises. So I want to invite all of you again to watch for Advanced Care Planning Day this coming Thursday. You may have heard Dr. Barb Zellick on the local radio station this past week talking about advanced care planning. She has prepared an advanced care planning document that's fairly specific to our communities here in Marathon, Terrace Bay, and Scriber, the communities that all of our hospitals serve. And my hope is that you can go to the Marathon Family Health Team webpage and access that document and have conversations with your family. And I'm grateful to the work of Dr. Barb Zellick to support those conversations. Most of you will have had the experience of signing off emails or conversations or letters with the language of stay safe. And I don't want to end this conversation today by saying stay safe. I want to say stay brave. Those conversations take courage, and I hope that you will stay brave and have conversations with your families this week. And again, document those so that we can continue to support you. Thank you for staying home as much as you can. Thank you for following the social distancing guidelines. Your commitment to supporting your fellow citizens across all of our communities and to supporting the healthcare system here is truly making a difference, and we are grateful to you for all that you're doing. Stay brave.